Hello and welcome to the Oral Health channel. I'm your friendly neighborhood dentist, Dr. Rudra Mohan, and today we're going to be talking about wearing away of teeth, that is attrition of teeth. Let's start. So today I'm going to be talking about a problem that is in their 95%, more than 95% of the population, which is known as wearing away of teeth or attrition of teeth. This is a normal physiological process that happens over a period of time, that is decades, as you age, because your teeth tend to get ground away because you are chewing every day at least twice or thrice, and you're doing it on a daily basis. It's very simple logic that the substance, that is the enamel of the tooth, will definitely go under some sort of attrition over a period of time. You might not get any symptoms over it. However, if you are a patient who suffers from night grinding or bruxism or clenching or bruxomania, as that we call, these are different types of ways of grinding your teeth. However, if you are a patient who grinds their teeth subconsciously or unconsciously, it might be a problem for you. Let me explain this. A lot of people, while they're sleeping, tend to grind their teeth. The sound that is produced is like this. Now, this kind of sound is generally associated with something known as night grinding or bruxism. Now, bruxism can be associated with a lot of things, especially it's more related to the psychology of the patient. If the patient is very high strung, they tend to think too much, their brain activity is much higher while they're sleeping compared to the other people, and they tend to overthink, they tend to analyze in their in their dreams or in their sleep time, and then they tend to grind their teeth. Usually when they wake up in the morning, they feel some sort of tenderness here around the jaw. Why I want to draw the attention of people who are going through something like this is because of the fact that you are grinding away your tooth substance at a much faster or a much pathological rate, which can lead to problems such as shortening of the teeth. At the same time, your jaw might collapse over a period of time. I'm talking about decades, but then again, it can give you other problems. If your teeth are not as sharp as they used to be because of grinding, you might have problem in chewing your food. You might not be able to digest the food properly because of the fact that the cutting or the sharing sharing aspect of the teeth is not as great as it used to be. So please try to make sure that if you do have this kind of a problem, you should go to your dentist, get yourself checked out. There's something known as an occlusal night guard, which you can wear while sleeping, and all the forces will get transmitted very naturally to the appliance, and you would be symptom free in a very short time. At the same time, if you're a sports person who is an athlete or a power lifter who likes to concentrate a lot, hyper concentrate when they're doing some exercises such as powerlifting, at that point of time, to consciously make sure that you are exerting the right amount of effort in doing whatever you're doing as a form of exercise, you might be consciously or subconsciously grinding your teeth. Once that happens and you grind your teeth, they will tend to give away in some time. I've seen this very often, and for this you can use something known as a sports guard. Basically, you can get an occlusal splint for that matter, so that if you do something like that, it can be avoided. So this was about night grinding or bruxism. Clenching is also something very similar. It's something of a scientific purview, but then again, I'm just trying to tell you that if you have this kind of a problem, it can cause long-term problems as well. Not only just the jaw problem, maybe the joint problem as well over a period of time. In some cases, I've seen if the people who do this, as well as they consume a lot of aerated or acidic drinks, their teeth will tend to get withered away much faster. And we've had cases to see where people have to undergo RCTs, intentional RCTs, and at the same time going for full mouth bridges and caps. So this is something that I feel that you should not ignore. If you do feel that something like this is happening, or if someone from your family says that you make some noises while you're sleeping with your teeth, you might as well want to get yourself checked out from a dentist, and they will tell you what to do. So this was today's small episode about grinding or bruxism, and at the same time attrition. So what you need to understand is go to your dentist and get yourself checked out. Have a good day.